Hey there, welcome back to the channel. If you're over 50 and struggling with erectile dysfunction, or know someone who is, you're not alone. In fact, over 70% of men over 50 report some level of ED. But why does it happen? And more importantly, what can you do about it? Stick with me for the next few minutes, we're breaking down the real causes of erectile dysfunction after 50. No fluff. Just science-backed facts, real talk, and practical advice. And don't forget, if you find this helpful, hit that subscribe button and tap the bell so you never miss health tips made just for you. First, let's clear up what erectile dysfunction, or ED, actually is. It's not just about not getting it up. ED is defined as the consistent inability to get or maintain an erection firm enough for sex. An erection involves blood flow, nerve function, hormones, and even your mental state. When even one of those systems isn't working right, things can go sideways. And after 50, that risk goes way up. While ED can be a normal part of aging, it can also be a symptom of underlying health issues or a side effect of medication. Let's start with the biggest culprit, poor blood flow. As we age, our arteries naturally become less flexible, and plaque can build up, a condition called atherosclerosis. If your heart isn't pumping blood efficiently, your penis isn't getting the supply it needs. In fact, ED can be an early warning sign of heart disease. So if you're experiencing ED, it's not just a sex issue, it could be a heart issue. A heart-healthy lifestyle is also a penis-healthy lifestyle. So keep watching, we'll talk about what you can do about this later on. Poor blood flow is a significant contributor to erectile dysfunction, especially after the age of 50, due to age-related factors and increased prevalence of conditions like heart disease, high blood pressure, and diabetes. These conditions can damage blood vessels and reduce blood flow to the penis, making it difficult to achieve or maintain an erection. Next up, hormones. Specifically, testosterone. After 30, men's testosterone levels start to drop, by about 1% per year. By the time you're 50 or older, it can make a real impact. Low testosterone doesn't just affect your libido. It can also reduce energy, mood, muscle mass, and yes, your ability to get and maintain erections. If this sounds like you, talk to your doctor. A simple blood test can tell you what's going on, and treatment options do exist. Testosterone is a hormone responsible for male sexual development as well as sexual desire in all sexes. Low testosterone can affect the ability to achieve or maintain an erection. This can be due to reduced blood flow to the penis, as testosterone plays a role in the process. Testosterone is a key hormone for sex drive. Low levels can lead to a decreased desire for sex, making it harder to get aroused. Now, let's talk about something most men don't like to admit, mental and emotional health. Stress, anxiety, depression, and relationship problems can absolutely cause or worsen ED. When you're stressed or anxious, your body goes into fight or flight mode, which shuts down non-essential functions. Guess what's not essential in a crisis? Yup. Erections. Performance anxiety is a real thing, especially if you've experienced ED before. It becomes a vicious cycle, one bad experience leads to worry, which leads to more bad experiences. There's no shame in seeking therapy or talking to a counselor. Your mental health is part of your sexual health. ED is a complex issue, and while physical conditions can play a role, psychological factors like stress and anxiety are frequently cited as contributing factors. Anxiety about sexual performance can exacerbate the problem, creating a cycle of worry and difficulty. Another big cause: medications and medical conditions. If you're over 50, there's a good chance you're taking something for blood pressure, cholesterol, diabetes, or depression. Certain surgeries and medications can cause or contribute to erectile dysfunction. Prostate surgery and radiation therapy for prostate cancer, as well as some medications used to treat prostate cancer, can lead to ED. Additionally, many other medications, including antidepressants, anti-anxiety drugs, and certain blood pressure medications, can also have ED as a side effect. Many of these can interfere with blood flow or nerve signals, making erections more difficult. And chronic conditions like diabetes or nerve damage from surgeries can be huge factors too. Host, if you've noticed ED symptoms shortly after starting a new medication, bring it up with your doctor. There may be alternatives. Pelvic surgeries, including those for bladder or rectal cancer, can also affect erectile function due to nerve or blood vessel damage. Here's the good news: ED is often treatable, and even reversible, especially when caught early. Let's talk solutions. Exercise regularly, especially cardio. Eat heart-healthy foods like leafy greens, berries, nuts. Quit smoking, it damages blood vessels. Limit alcohol, too much can shut things down. Get quality sleep, hormones reset while you rest. Mindfulness, meditation, and even yoga can reduce stress and improve blood flow. There are also medical treatments, like oral medications, yes, those ones, vacuum pumps, hormone therapy, and even shockwave therapy. Your urologist can help you figure out the best path. So, if you're over 50 and dealing with ED, don't panic, and definitely don't suffer in silence. Know that you're not alone, and there are solutions. If this video helped you better understand what's happening in your body, give it a like, and leave a comment if you have any questions or want us to dive deeper into any of these causes. And don't forget, hit subscribe and tap that bell icon. We're building a community focused on men's health, confidence, and living better after 50.